Wellness tips sa Health Check Plus. Katawan, kagandahan, kagalingan, ating alagaan. Dito lang yan sa Wellness Tips sa Health Check Plus.
Nagbabalik ang Health Check Plus. Kasama po natin ngayon si Nathalie Ernoult. Siya ay Deputy Health of Policy and Advocacy of Access Campaign ng Doctors Without Borders. Good day to you, Ms. Nathalie, and welcome to our program, Health Check Plus.
Thank you so much for inviting me.
Yes, Ms. Nathalie, our preliminary question, our primary question would be, can you tell us about the Access Campaign and what is your role in the program?
Okay, so the Access Campaign is one entity of MSF, Doctor Without Border International. It's the entity that is in charge of, doing advocacy to improve access to medicines and medical products for MSF, but not only for MSF, actually. Whatever action we take to improve access to medicine is also improving access for countries, so the impact is just beyond MSF itself.
And so that is what you do. You push for access to medicine and medical products. And Ms. Nathalie, maybe my question would relate to the new global public health emergency, because the WHO, we know, has recently declared monkeypox as a global public health emergency. And may we know what has MSF so far done in regard monkeypox, and in relation to that, what would you recommend the Philippines do to minimize threat of monkeypox?
I'm going to be very, very honest here. I think, MSF right now is not having a position per se on monkeypox. I think we're waiting, also for WHO to come with their recommendations and define the strategy. It is the role of WHO to provide norms and guidance for countries. So I would leave it for now for WHO to take the full responsibility they're already taking on this topic.
Yes, and so but we know that the Access Campaign, which started in 1999, has done a lot of things to achieve what you said is access to medicine and medical products all over the world internationally. And what have been the challenges or obstacles so far in the program, especially during the time of the COVID-19 pandemic?
Okay, so obviously the Access Campaign has been created in 1999 with the Nobel Peace Prize funding actually that MSF received, and so concentrating really on access to medicine. So in some of the key, I would say, successes of MSF was obviously the decrease and the drop in price of antiretrovirals, for people living with HIV/AIDS. I think it was, a massive success at the time, where not only MSF, but also patient groups, activists, and some countries, all together joining forces managed to basically ensure that the price was dropped by 99%, in a decade. So I think that's one of the major success. But now, if we're talking, but it is emblematic. I think it is important. It was quite emblematic, and it has shown that the way prices are set, and innovation is rewarded, is having an impact on access to medicine. So I think it was, quite emblematic to mobilize a number of, researchers, civil society groups, governments to work on access to medicines. And what we see now, if we look at what has happened, in the situation of the pandemic, actually we've seen also that there were some tools, medical tools, even if the innovation was not there. I mean, we had to wait a little bit to access the innovation, but there was massive inequity in access to these, COVID tools. And what is playing out is sort of the same rationale. What we have is, on one side, you have massive public investment to stimulate innovation, research, development, to cover the risk of the development and the production. all these products have been pre-purchased, in particular vaccines, if we're thinking about them. So there was no risk, I would say, for the pharmaceutical companies. But on the other side, despite the fact that there was massive public investment, there was no sharing of knowledge, no sharing of, patents, of intellectual property, to share this knowledge with different countries who had some industrial capacity and allow for the scale up of the production. And because of that, which I think is the main challenge, we didn't see an access, to these tools, and in particular to the vaccine. What we've seen is a very delayed access to these tools, I would say, So that's, I think, was the biggest challenge. And behind that, what we have to understand is that, the decision of being in such a situation is a political decision. It's the way the research and development, it's the way innovation is funded. It's the way the system is organizing the delivery of these products. And I think in the case of the pandemic, because, the whole planet was, impacted by it, the people who designed, the response globally and worked on it have been, using old-fashioned, I would say, an old way of thinking about how to, organize the development of products and how to deliver them. And within that, I think what is important is that in the governance of, the management of the COVID-19 response, there was just a few countries who have decided for the rest of the world when regions and countries should have a say in, the conversation. And they were not really part of the governance. I think that's probably the other biggest challenge, is to, disregard, in a way, the role regional institutions, regional bodies, and governments can play, in organizing the response, but in also funding innovation. And this is probably the other, second part that is important in terms of the challenges we've seen. Because, sorry, go ahead.
Yes, I was just thinking about maybe you see any similarities, because you said in 1999, and this is one of the bigger campaigns that was won by MSF, the 99% lowering of the amount or the value or the price of ARVs. And do you see the similar hindrances or challenges or obstacles when it comes to the access to vaccines, for example, in the time of COVID-19? Would there be similarities?
There are some similarities. I think the underlying, system, the way the system is organized, which is basically to, have public funding for research and development, and the creation of monopolies by keeping, the intellectual property and not sharing the knowledge, for example, of publicly funded innovation. This, we see some sort of, in a way, you could see that the underlying problem is really about, how research and development is being organized and financed and delivered. So in that sense, yes, there are some similarities. On the other, it's sort of different also, because this was a pandemic. We had no tools for HIV/AIDS. We had tools, but they were, priced out of reach for most of the countries. But in the case of COVID, we had no tools at all in our hands, at the beginning of the crisis. So therefore, there was a need to invest. The thing, what has happened is that the public investment for COVID-19 tools has been massive. It's billions of dollars that have been invested, but it has translated into private profit rather than public good, right? And that is, I think, one of the biggest challenge. And it means that we need to revisit the way also, and government should revisit the way they are funding innovation and the way they are, setting some conditionalities to ensure that at the end of the day, the public money is transformed into a public good, I would say, which is not, has happened.
Yes, because like what you said, for example, in the case of vaccines, these were pre-purchased. So even before, for example, in the Philippines, we had our first doses, or even the frontliners would have their first doses. We already paid for or allocated money, but then it took a long time for us. We just like hearing the news that some countries have already rolled out vaccines, but then the access of countries and not just individuals, hence also individuals to these vaccines are really was really very difficult, and there was really inequality on the part of really a third world countries like the Philippines. And maybe this is what you're saying, that we think outside the box and remove the traditional spending or funding of research and innovation, so that we also support more progressive or more independent researchers who not totally disregard, but maybe put a premium on what you call these innovations or in researches, but they don't go beyond, and they don't stay within the traditional form of funding innovations like what we did before.
Exactly. Yeah, yes. I think exactly that's totally right. I think it is important because what we've noticed actually during this pandemic, that there are a lot of innovation happening in many countries. There was also a lot of industrial capacity to produce vaccines, but the reality is that the one who discovered some of these vaccines with public money were not ready to share. We're not ready to share the intellectual property. We're not ready to share the know-how to allow for the scale up of production. And I think that is really one of the massive problems. And it means that we need to revisit the way we are thinking and framing public and private partnerships. If this is happening, at some point, there is a need to reorganize, the powers, because the funding is coming from the public, is coming from you, from me, from, the rest of the world, from taxpayers. And there is, and at the end of the day, we are all owners, of this research in a way, and it should be made available for all. But to do that, you need to also, countries who are funding in their relation with pharmaceutical companies need to really set the conditions to allow for, an improved access, because otherwise what is happening is that you have a lot of public investment, you have a lot of profit, and the companies, the COVID-19 companies who have, developed, diagnostics vaccines have made a hell of a lot of money, And in a situation of a pandemic where people were not even having access to some of these tools, on time, because now people will say, yeah, but there is enough vaccine. Yes, but the reality that in the situation of a pandemic, you need to have access to these tools in a timely manner. And this didn't happen. There was a lot of delay in access to these tools, even diagnostics, for most of the countries.
Mm-hmm. So yeah, and I'm reminded because during 2022, when they imposed lockdowns in the Philippines, so we needed to test people who go around, or frontliners. We don't really have access even to kits in the Philippines, so it took a while for us to really put up our own laboratories just for tests. And right now it's very expensive. It's still very expensive. We see a lot of people outside the Philippines in more developed countries they have in their home kits to check for antigen kits to check for COVID-19. But then here in the Philippines, we need to go to the laboratory still and have ourselves swab and wait for like hours or days just to get the results. Or even kits, we have a problem with kits, not just vaccines. So I think that's where we should be leading. So not just medicines, but even medical products should like be accessible to everyone. Just so, because it is, this is how you fight the pandemic, to give everyone access to these medicines and medical products like the vaccines and the kits. And yes, maybe one of that second to the last question would be about the pandemic itself. So I think I mentioned about lockdowns, and I think MSF also studied about the lockdowns in the Philippines. Our lockdowns here would be very strict, so nobody goes out of the house. So do you think that the lockdowns can no longer be the answer to the pandemic? Because that's still how I think a lot of people would think
The
it should be
lockdown,
solved.
you're mentioning the lockdowns? Yeah.
Yes.
Yeah, it's very difficult to say. I mean, it seems, right at the beginning of the pandemic, I think there was no tool. There was also a lack of, understanding of the virus. It took a little bit of time to understand the virus, the transmission, the impact, on different groups. So countries had to take, measures to protect their own population. So it's never an easy, moment where you have to make this kind of decision. But now for the future, honestly, it's very difficult to say, because it depends how the virus is going to evolve, etc. But it's true that lockdowns, I think, we've seen it everywhere, had impact, massive impact on people, incomes, economies, in particular, daily workers. It had an impact on, mental health for most of the people as well, generating anxiety. So I think, I don't think we will find ourselves in the same situation now on this, on this pandemic. And everyone is also learning, by doing. Let's be honest, we all learned something about, about the virus, about COVID, and how to manage, even to protect ourselves and behave, I would say, in a way to limit and avoid transmission. So no, I don't think I have a specific, thing to say on this measure. Yeah.
Nathalie, maybe as a last question, we're very interested in what MSF International has to do, especially as its program access to its access campaign. Maybe you could share our listeners and those our televiewers the plans of MSF International today onwards, moving forward to under the pandemic.
Under the pandemic. So, I think for MSF, what has been very important also was to recognize that, in a situation like a pandemic, usually countries and even health workers and NGOs tend to focus, on the response to the pandemic. But at the same time, health systems are overwhelmed by the pandemic, but you still have other conditions, medical conditions, that needs to be treated and addressed. And what we've seen is also a drop, in access to ARVs, in, for access to TB treatment and routine immunization. So what is important, and MSF has been looking at also, is really to maintain and support, other, the other programs that we are usually supporting, and including the health system, including, providing support to, to governments, because of human resources also that were quite stretched, I would say. So that's what we are doing also, is looking at it from a broader perspective. It's not just about COVID, it's also about other medical conditions. And in terms of COVID itself, we are right now working, there are international discussions on the revision of the global governance, that was set to respond to this pandemic, which is called Act A. There is an evaluation right now. So the Act A, the Accelerator for Innovation. So we are right now contributing also to the evaluation of this, governance. And obviously, as I said, for us, looking at the governance is important, making sure regions are well represented in this governance, but also looking at, local production, how to make sure that for the next pandemic, there will be, and the global governance will be supporting, local innovation and production in different regions. The other, I think, aspect is really about, the hoarding of the product. How do we make sure, and I think it's linked to production, how do we make sure that there will be different ways of organizing public-private partnership? And what we are doing as well is we have organized a series of meetings. And actually, I was in your country 3 weeks ago. and with meeting with researchers, universities. So I was in the Philippines, I was also in South Korea, and what we're trying to do is also stimulate interactions, connections between middle income countries that have research and innovation capacity to come together to learn, because probably a different way of approaching access to products will be coming from your countries and from countries that are eager to have access to these products, but and that are also really mobilizing their own citizen researchers capacities to try to produce products, which they do, by the way. So I think that's something we are looking at also in terms of the Access campaign. Is really, I would say, we call it generally South-South collaboration, but I think, when we look at, what Brazil is doing, what the Philippines are doing, what, South Africa also is doing, there is definitely a lot of energy and a lot of political will also to do things differently. Yeah.
So thank you very much, Nathalie, and thank you for the work that you do. Good luck to MSF.
Thank you so much for inviting me.
At diyan nagtatapos ang Health Check Plus. Hanggang sa susunod na linggo, ako po si Attorney Mimi Campos Banay. Tandaan, ating pangalagaan ang ating kalusugan sapagkat ang kalusugan ay ating kayamanan, at huwag kalimutan, batiin araw-araw ang ating mga minamahal. Be kind, be safe, and stay healthy. Ang Health Check Plus ay production ng Vital PH Science Incorporated kasama ang Manila Broadcasting Company. Mapapanood ninyo ang iba pang video and health, wellness, and beauty sa YouTube channel ng Health Check Plus at www.youtube.com/c/healthcheckplusph.